There are warning signs that you can look out for when myasthenia gravis is getting worse. And if you address the worsening disease in time, then you can avoid hospitalization in any way. One of the most common misconceptions about myasthenia gravis is that it can very rapidly lead to a loss of the ability to move and the ability to breathe, leading someone to have to be on a ventilator in the hospital. While that can happen, the rate of decline is not that rapid. And in almost all instances, the person with myasthenia gravis is able to notice the warning signs of worsening disease and address them with their team of physicians and other care providers in a timely manner. Some of the warning signs that tell you that you need to get help for myasthenia gravis are, number one, any trouble breathing. That is one of the more concerning warning signs that the myasthenia gravis is getting worse. And that may be an indicator that a change in treatment may be necessary, or that that person needs to be in the hospital, at least for monitoring, in case they continue to get worse. Another warning sign would be trouble swallowing. Many patients with MG have some difficulty in swallowing, but most of the time it's fatigue with chewing, as opposed to difficulty actually getting the food down your throat, which would be a more concerning symptom. And lastly, any difficulty in holding your head up is a warning sign that the MG is getting worse and may need, again, a change in treatment or monitoring in the hospital. Another misconception is that people with myasthenia gravis have to avoid many different kinds of medications because those medications can make them worse. There are a certain number of medications that could potentially make myasthenia gravis worse, but it's a relatively small number of medications. As long as the person with myasthenia gravis discusses any new medication with their doctor, then that can easily be managed, and certain medications can be avoided, other medications used with caution, with just higher level of monitoring for any worsening symptoms. Most people with myasthenia are able to take other medications for other diseases without any issues. Another misconception about myasthenia gravis is that people with that condition are not supposed to exercise. So while it's true that repeated movements can make the weakness in myasthenia worse, exercise in general is actually good. It helps to strengthen the muscles. It helps to reduce fatigability. But people with myasthenia just have to be more careful about how they exercise. So low weight when you're doing any weight training, fewer repetitions, taking frequent breaks in between sets of whatever you're doing, whether it be weight training or something else. But taking the appropriate precautions before exercising will actually improve quality of life in the long run.